Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all topics in a very systematic order, and definitely you can make use of it. So in the last class, we were discussing about vitamin D metabolism and how physiologically it will going to work in the process of absorption of the calcium. Now, today we will see one of the main role of vitamin D is absorption of the calcium and as well as phosphorus. But apart from that, vitamin D has got its role in the calcemic benefits of the vitamin D. Now, we have to discuss about the calcemic benefits of the vitamin D. One that we have already discussed. That means how it helps in the calcium absorption and phosphate absorption, and then how it helps to maintain the calcium level in the blood and also in the bone. This part we have discussed when we discuss the vitamin D metabolism. Now, apart from that, so this is also important for maintaining the body immunity. This is also very important for prevention of the recurrent infections. Vitamin D has also got some of the neural effects. It has got some of the effects over the neurological system, and vitamin D is also important for prevention of the skin problems and also skin cancer, etc. So this also we have seen to some extent. Now, how much we are repeatedly talking about dehydrogesterone, which is deposited underneath the skin, and when UV light falls on it, so that will get converted into its next storage form in the liver. Now, thing is, how much sunlight is required for this process? In the last class also we have discussed. This is a big debate. Okay, now it will going to differ from geographical area to geographical area. Okay. So in latitude, in with particular attitude, actually in what we say akshangsha and rekangsha, in that particular angle the sunlight falls, that also matters very very much. Angle at which it is falling, and that is very important. If this person is exposed to that particular sunlight, to that particular light which is not falling in the required angle, so that may lead to so many skin cancers also, because of the adverse effects of the ultraviolet rays. So in Caucasian population especially, the exposure of 10 to 30 minutes is sufficient. Caucasian population, the exposure of 10 to 30 minutes of sunlight is sufficient to initiate this process of vitamin D formation. While in our situation, especially Asian situations, it should be around 50 to 300 minutes. This is what is recommended, which is quite impossible in India especially. Okay, this is told that 50 to 300 minutes we have to get exposed to that. Quite impossible in Indian situation, especially in the summer and also in winter. In winter there is a scarcity of the sun rays, and whereas in summer it is intolerable. Now, the black pigment melanin, which is present in the skin, actually that will going to resist the entry of ultraviolet rays. Melanin is present, which is a black pigment which is present in the skin, and one of the main role of this melanin is it will resist the entry of these rays inside the body. Okay, so those who are having more melanin, so usually they will have the black complexion, and what actually happens is the ultraviolet rays are not allowed inside the body, and this may be one of the cause for the increased vitamin D deficiency in India. Maybe this is one of the important cause. We have got major population is having a little black complexion because of increased amount of the melanin, and later what they are telling is 50 to 300 minutes of sunlight exposure is required, which is quite impossible even in the fair. That means those people who are having less melanin pigmentation deposition. So in totally, this may be one of the cause where we are finding, and because of which we are finding the high incidence of vitamin D deficiency in India, although this is a tropical country. Now, when should we worry about vitamin D deficiency from the clinical point of view? suppose. So these are all the other parts, theoretical parts. Now clinical point of view, when we talk, so actually when we have to worry about vitamin D deficiency. Now the calcemic effects of vitamin D, suppose you are talking rickets is one such condition. Then even in case of dilated cardiomyopathy in the fetus and hypocalcemia in neonates. So these are the three important conditions where because of the vitamin D problem, the calcemic problems, calcemic effect related problems are coming. Okay. Then we come to the non-calcific effects of vitamin D deficiency. Number one is allergic. The allergic manifestations, they also increase, or allergy will not be under control if you are having vitamin D deficiency. That's one point. In case of bronchial asthma and non-calcemic effects of vitamin D deficiency also includes diabetes 1, then cancer, etc. Okay. So these are some of the non-calcemic effects clinically that we should be very careful. Suppose a patient coming from allergy, we should also think about vitamin D deficiency. Child is there with the bronchial asthma, also think about vitamin D deficiency. Okay, and even in case of DM1. Now in children, especially when you talk, as the epiphyseal plates are not completely closed in children, the disease of the growing end of the bone causes the deformity. Adults, suppose calcium deficiency occur, vitamin D deficiency occur, as far as bone is concerned, there will not be much problem, although bone density may come down. Because bone is completely formed. Suppose after 30 years, bone is completely formed, epiphyseal ends are closed, and okay, then the ossification centers are completely closed, blown up and closed. So no issue. The complete formation of the bone has been taken place, and as far as bone-related problems related to deformity, etc., will not occur. But unfortunately, in children, bone is on the process of development. Okay, epiphyseal centers are not at closed. Epiphyseal end are not completely fused. The bone growth is on. The process is on. So during that time, if the calcium deficiency occur because of vitamin D deficiency, then epiphyseal plates will not be get closed properly, and as a result, the bone becomes epiphyseal ends. They becomes soft. Okay, even shaft becomes soft. Shaft also becomes shaft. Shaft, lower and upper limb, etc. And on this soft area, so when the continuously pressure falls, whenever baby do any activities or child do any activities, so it will get deformed. Okay, it will just like a elastic. If you continuously stretch it continuously, at the one point of time, it will go into deformed state. So no elasticity existing. Okay, fixed one. So similarly, the deformities will be there in the bone. So this is one of the main problem of vitamin deficiency, D deficiency happening in children because of calcium problem. But this problem is not there in the adults, because while in the adults, as the growth plates are already closed, so it causes the weakness of the bone. Maximum it causes the weakness of the bone because of the density of the bone is reduced, osteoporosis like conditions. And there may be sometimes recurrent fractures. Apart from this ricket like condition will not be there in adults. So therefore always we say ricket is a typical disease of the children, especially disease which start from the early infancy. When although many times it is diagnosed after 2 years. Okay, but actually the pathology start from early infancy. Therefore vitamin D supplementation right from the birth, so that's very important. Okay, yeah, otherwise you go to the vitamin D supplementation or you adopt some other methods like proper sunlight exposure and all those things. That is very important in the early infancy. That's the reason what Ayurveda explains about the Suryodaya Darshana Samskara in the first month of the life. First month of the life, child should be frequently exposed to the sunlight. Suryodaya, that means early morning. So what they believe is during sunset and sunset, mostly although the modern theories gives so many other explanations, so what Indian philosophy, Indian Vedas, Upanishad and also Indian textbooks, so what they say is morning hours during the time of the sunrise and evening hours during the time of somewhere some 30 minutes prior to and after that. So that's the time where sunlight has got this ultraviolet range. Okay, so near ultraviolet range. So therefore Suryodaya Darshana Samskara is explained. Okay, Suryodaya Darshana Samskara is explained in our science, and they very clearly told that it should be begin. You have to initiate Suryodaya Darshana Samskara from first month of the life itself. That means it's a disease of early infancy. So therefore they are telling that you should begin it from the first month of the life itself. Now some of the very important functions of the vitamin D, many times we have discussed this, helps to maintain the proper plasma level of the calcium and the phosphate. It increases intestinal absorption of the calcium and phosphate, bone resorption and bone mineralization, two important functions. Now, so this is all about vitamin D, how it forms, storage form, active form, and many other things are there. Now, alpha 1 hydroxylase enzyme, 1 alpha hydroxylase enzyme, very important enzyme, because if that enzyme is absent, there will not be any active form of the vitamin D, and that leads to the rickets. Now, this type of rickets which occurs because of the kidney problem in the sense, either there is some pathological changes in the kidney, or there is alpha 1 hydroxylase enzyme deficiency, or there may be some renal tubular disorders which leads to improper functioning of this particular procedure, may lead to deficiency in the active form of the vitamin D. You are taking sufficient amount of the vitamin D in the diet. You are also getting yourself exposed to the sunlight. The storage form of the vitamin D is formed in excess, no problem, no doubt. But unfortunately, this storage form has to be converted into active form, which is only possible in the kidney by the help of a 1 alpha hydroxylase enzyme. Suppose this enzyme is absent, then the whole story goes in a different direction, and we call that particular rickets, which occurs because of such condition, is as refractive effects. Okay, they are also called as non-nutritional rickets, or refractive rickets, or resistant rickets. Okay, so far what we have discussed, suppose if the problem is there because of improper sunlight exposure, or diabetic problems, malnutrition, etc., they are all the causes of nutritional rickets. So now here we divide rickets into two types: nutritional rickets and non-nutritional rickets. If only diet is a problem, if only the improper sunlight exposure is a problem, then it leads to nutritional rickets. But if this part is okay, the problem is there in the kidney or some other areas, and there is no proper formation of the active form of the vitamin D, or if active form of the vitamin D is formed, there is some problem in the absorption from the intestine because of some other cause. They are all considered under the heading of a non-nutritional rickets, or they are also called as refractive rickets or resistant rickets. So next that we will discuss that particular parts. Now, the most common is a nutritional deficiency of vitamin D, what we discuss under the nutritional rickets. So that we will discuss in the next class. Thank you very much.